Hundreds of millions of people worldwide suffer from hair loss every single day. And do you know how many of them get proper medical treatment? Any idea? Just 1%. But those people, they want a solution. They are looking for a treatment. And if we don't give this the treatment, then they are searching for somebody else, charlatans, promising them wonder solutions. There are no wonder solutions in hair loss. That is the bad news. But you know, an average hair clinic or an average laser clinic performs roughly 1 million shots every single year. Do you have any idea how many shots that we perform in our clinic? Just on Urban Yak, just on hair restart. Any idea? 2 million? Let's count together. We perform 80 million shots just on hair restart every single year on our patients. So that's why I'm here. And I would like to inspire you today. Maybe you are already treating patients with hair loss, and that's good. If not, maybe I can inspire you to start your hair growth clinic. And when we work together, we can really treat those patients and make a difference. So I would like to present using the patient journey, because I believe that the patient journey is really a very important step in every clinic. And we will use the journey of Sophie, who is one of my patients. And we will go through every single step of this patient journey. And Sophie found us through the internet, and she booked an appointment online. And before she came to the clinic, we sent her some information, a warm-up, just to make sure that she got some information beforehand. And she already knew us too, so she was more confident. And then she came for the first consultation, and when patients set foot in one of our clinics, for us it's really important to make them at ease. So we offer them a warm welcome. We make sure that they are comfortable, offering them some coffee, because if they are comfortable, they will start to listen to what you have to say. And then the actual consultation begins. And we have to start by listening to the patients. What is their story? And in the case of Sophie, she was a very proud woman, dressing elegantly, taking good care of herself. But then at the age of 35, her hair started to thin. And this really changed her life. And she sought medical attention, and she was put on the classic medication, minoxidil. But unfortunately, it was insufficient. The condition got worse, and she had to buy a hairpiece. So can you imagine how ashamed she was? Even her husband was not allowed to see her without the hairpiece. It was like a dark shadow over her life. It's very important to set the diagnosis right. We have to become experts in hair loss. And for me, if the diagnosis is wrong, at best your patient loses valuable time, and at worst, you may cause permanent damage. So we have to become an expert. And for me, the diagnosis is set on 3 aspects: anamnesis, physical examination, and trichoscopy. And unfortunately, also in the diagnosis of Sophia, we made the diagnosis of androgenetic alopecia, also known as male or female pattern hair loss. And this is how it looks like. This typical pattern. On the midline, we see the thinning. In male, there's a different pattern. As you all know, it's focused on the frontal area. It's focused on the crown area. And the third aspect is trichoscopy. And if you do not use trichoscopy, I welcome you to start doing it. Because with trichoscopy, not only you can make sure your diagnosis is the right one, but you can also rule out other diagnoses. So let's have a look at the trichoscopy of Sophie. And if you see the blue spot, this is what we see when you have a diagnosis of androgenetic alopecia. Some hairs are thick, some hairs are thinner, and we have this hair shaft diameter variability, also in the case of Sophie. And we show this to the patients, because when they see this, they really know the problem and they have to go for it. So in short, you go from many thick hairs to fewer thinner hairs. When you set this diagnosis, you have to bring it with empathy, because many patients still think they don't really have a problem. They think it will subside in a few weeks or months, but not in the case of androgenetic alopecia. It will get worse. And also in the case of Sophie, it was a bitter pill to swallow, and she really had to think it over for a few weeks or maybe longer. So we sent her follow-up emails, we gave her some more information, and when she decided that she was ready, she contacted us again and she made the booking for the treatment. And in fact, people decide when they are ready at their own pace. It can take weeks, it can take months, or sometimes even years. So when Sophie came in for the first treatment, we first did some measurements. We took some global photographs, of course, but we also performed another trichoscopy based on artificial intelligence. And this is very important, because in this way, you can exactly show them where they are at this moment. But also, when you redo this examination, let's say in 1 year or in 2 years, they can really follow up how they are going to evolve. And she knew it would take a long time. She knew it would take at least 1 or 2 years to get the hair and the head of hair that she wanted. But she was there to persevere. So we decided to start her on a combination therapy, Photona hair restart, in combination with platelet-rich plasma therapy, or PRP. We also offer other treatments in our clinic, micrograft therapy, mesotherapy, microneedling, but we decided not to do this with Sophia. And combination therapy works. As Niels Shaddick shows in this picture, in this paper, when we combine therapies, you will get better results. And we know for years that when you combine minoxidil with PRP, you will get better results. So this is what the acronym hair restart stands for. It's epidermal, superficial, thermally activated regeneration of tissue. And when we have a look at the proposed mechanism of action, we have 4 different mechanisms. And the first is that fractional urban yak pulses activate the signaling pathways, increasing hair growth, bringing the hairs from the telogen to the anagen phase, activating the wingless NT pathway and the beta-catenin pathway. A second mechanism is the release of growth factors and also extracellular matrix proteins. A third one is vasodilation and angioneogenesis, increasing the blood flow at the level of the dermal papilla. But we also reduce inflammation at the level of the hair follicle, because we decrease bacterial and fungal colonization. So this is the new handpiece. It's called X-Restart, and you see all the advantages on the left. And of course, you can always use R11, PS03, PS03X, but if you have to treat your patients, making lines parting the hair, it will take you twice as long as with a new handpiece. So for me, it's so good that I decided to equip all our SP dynamicists with it. And this is how it goes. And we gently comb through the hairs. It's a very nice motion. They don't feel any pain. Sometimes they even fall asleep, especially in winter time. And this is a protocol that I would like to share with you. So we use the SP Dynamics in the urban yak wavelength. We use the extra start handpiece, and the fluence depends 4 to 6 joules per square centimeter in smooth mode. Frequency 1.6 to 3.3 hertz. And at least we give them 5 passes, gently calming, and we go to a maximum of 2,500, 3,500 joules for an entire scalp. We use a long spacer, and we use 8 sessions with a 2-week interval, and we follow up with 1 monthly session for 8 months. Did you know that there are 2 different ways to perform hair restart? The one on the left is a stamping mode, and it's developed by Fotona. And what you see here on the left, you push firmly with your handpiece on the scalp, and you give a burst of 2 shots, chak chak. And then you move on to the next area and the next area. The technique that we developed in our clinic is a calming technique. It goes slow. Okay. And you see that the heat delivery in the 2 different techniques is the same. So when we explain to our patients what we would like to do, we always refer to this Disney princess sitting in front of the mirror, combing the hairs very gentle. And you have to remember, you have to go slow. So, what time, in one point in time, you have to evaluate. And in 1 year, 12 months, there was improvement in the hair. At 18 months, she was able to set aside the hairpiece. And at 22 months, these were the results. And I have to say that she was really very happy with the results, and she still is very happy. So, some more results maybe. This is my first patient, and she was an older lady, 63 years old, and she was having hair loss problems for 18 years. So we started to treat her with the R11 handpiece. She was not a good candidate for PRP treatment because she was on steroids. So in 18 months, you see on the right the results. 18 months, 18 sessions. Another older lady also treated with the R11 handpiece. She was having a hairpiece and she could leave it aside. This is our first patient treated with the Extra Start handpiece. In the study protocol, we just did 8 sessions in 4 months' time. And 6 months later, I took these pictures in the follow-up. And actually, when I saw her back a few months earlier before here, we definitely saw that also the quality of the hairs got better. You don't see this in this picture, but now it's also increased in quality. So Sophie again, and I told you that we did combination therapy, so we did use the Extra Start handpiece, but we combined with very high concentrated PRP. It's called the Angel system from Artrex, giving us a 5 times increase in the concentration of blood platelets. So we did 24 sessions of laser, 8 sessions of PRP in 22 months. You also see that the frontotemporal area increased as well. And this is especially due to the laser therapy. Another patient with long-standing alopecia areata, treated with laser only, 14 sessions, 8 months. And have a look at the right side on the back. If you see this picture, you wouldn't say she has any problems with the hairs, right? You see there's an increased density, just laser. Another older patient, treated with the R11 handpiece. Again, 14 sessions in 12 months. And this patient had not hairpiece, but extensions. And she wanted to get rid of the extensions. So we tried to treat her with laser therapy only, 80 sessions in 60 months, and this is the results. But also on the back, you have a quite good improvement. So that's one of the advantages of laser therapy. As long as you put your foot on the pedal, the energy is there. With PRP, exosomes, mesotherapy, when the bottle is empty, it is empty. We also treat male patients. This guy had a transplantation before, but he saw that there was more thinning coming, especially on the crown area, also on the frontal area. So we decided to treat him with combination with Angel PRP and Hairstart, just 9 sessions of laser therapy, 4 sessions of PRP in 12 months. And he was very happy. And this is the frontal area. Big improvement of the density in the frontal area. And he was very happy because he didn't want to start on finasteride or dutasteride. So we kept him and his hormones at a normal base. This is one of my younger patients, and she was really feeling depressed because of the hair problem. And we treated her with laser therapy, 1 monthly session for 2 months, and 2 sessions of PRP. And this is the first result. And the hairs, they started to grow really quickly. We know it will get better even in the future. This is the back. So we're also here to celebrate 60 years of Fotona and Fotona innovation. And there's also some innovation in the field of hair loss. It is called Hairstart Duo. And it just refers to the fact that we are using 2 handpieces and 2 different wavelengths. You see the extra start on the left, and on the right side is the marker for the comfort lace. So we combine Irwin Yak laser with neodymium yak laser. We combine the heat shock effects with the PBM effects, the photobiomodulation of the comfort lace. Yes, because we know also for years that low-level therapy, photobiomodulation, works for hair loss. This is the test protocol, and it is just a test protocol that we are using. So hopefully in the next session we can show some really results from our patients. So I hope today that I have inspired you to maybe start your hair growth clinic, maybe to extend it. If there are any more questions, please be free to ask me. You can also follow us on the social media, or you can have a look at the website of the hair clinic. Thank you very much.